Now we're looking at the next artery. Artery that we're going to talk about is anatomy, and this is what is known as a posterior circumflex humeral artery. Posterior circumflex humeral artery. So this is the posterior circumflex humeral artery. This one. Okay. So the posterior circumflex humeral artery is that it's the third branch of the axillary artery. It passes through the quadrangular space with the axillary nerve. So it winds around the surgical neck of the humerus and it supplies muscles like the deltoid muscles, the teres minor muscle, the teres major muscle, long head of the triceps, shoulder joints, and the proximal humerus. So it arises from the third part of the axillary artery, occasionally from the subscapular artery. I get it. It's a posterior circumflex humeral artery. So what next? It runs posteriorly with the axillary nerve, passes through the quadrangular space, winds around the neck of the humerus. So it gives branches that actually supply muscles like the deltoid muscles, the teres minor muscle, the teres major muscle, the long head of the triceps brachii, then also articular branches that will now keep supplying the joints. Okay. So distribution supplies the deltoid muscle, the teres minor, the teres major, long head of the triceps brachii, shoulder joint capsule, proximal humerus. So it travels with the axillary nerve through the quadrangular space and anastomoses with the anterior circumflex humeral artery around the humerus, communicate to the suprascapular and the thoracoacromial arteries. So we study this artery because it can be involved in a type of syndrome known as a quadrangular space syndrome. We study it because it can be affected when there's fractures of the surgical neck. We studied because it anastomoses with several arteries, giving a collateral supply around the shoulder joint.